60 women physicians gathered. We're an eclectic mix of surgeons, specialists, and primary care docs. We are all interested in learning more about whole health medicine. In fact, we had a great discussion about Roseto, Pennsylvania that Shane mentioned earlier. And while we spoke about what an honor and a privilege it is to care for patients, we also spoke about the dear price tag attached with that honor. You might hear about the students who finished with $250,000 of debt. You might hear about the 3 to 7 years of residency with 80-hour work weeks. You might hear about sleep deprivation and stress and information overload and vending machine meals. But you might not hear some of the other stories that we talked about that day. You might not hear about flying scalpels. You might not hear about verbal and psychological abuse. You might not have heard about the resident who spent all night up taking care of sick babies in the NICU, only to be reprimanded the next day. Later that morning, she looked out a window and looked at the pavement, and she thought that might be a reasonable way to end the pain and the shame. You probably didn't hear about the resident who dared to get sick herself. But despite her fever and her vomiting and her diarrhea, she still showed up to the OR. So they sent her to the emergency room, and she got fluids, and she got IV medications for her vomiting. But she also got a diaper so that she could go back to the OR and scrub in. And then, you might not hear about the lost relationships and the preemie babies and the infertility. Out of this group of 17, 9 had no children. 2 were by choice, but 7 were by circumstance. And then you finish training, and you think, we're home free. I get to have a life and a career. And then you jump into the alphabet soup of complexity, some of which you've already heard about today. It's an alphabet soup of ACA, AMA, CMS, the boring ICD-10, the equally boring HIPAA. And then you realize that 15-minute appointments are a luxury. Try to please patients, families, staff, administration, medical boards, and society. It's a bit harder on women physicians because despite professional roles, we still take care of most of the stuff at home. But both genders suffer. We're told, take better care of yourself, would you? Be a model for good health, right? But recent surveys say that most physicians would not recommend a career in medicine. They say that the price tag is just too high. The honor and privilege has become tarnished, and this broken system breaks healers as well as underdelivers to patients. Though I've known darkness, I still see light. So coming in 2015 is Modern Medicine Women, a unique, small, boutique retreat conference for physicians. And it's designed to restore, enlighten, inspire, and empower physicians to love medicine again so that they can heal themselves and better heal others. Thank you.